Have you ever Googled questions and just wished that there was a doctor on the other end ready to answer them? This is your chance. Let's go to Google and see the top questions on GERD. Let's start with what GERD feels like. So GERD can have many feels. It's most commonly described as heartburn, a sense of burning under the chest, but it can have a lot of other symptoms. And as we go through more questions, we're going to get to many of those. Now, here's a good basic one. What does GERD stand for? It stands for gastroesophageal reflux disease. And what that denotes in plain English is that contents from the stomach are traveling back up into the esophagus and causing problems. What GERD can cause? GERD can cause a number of symptoms. Heartburn and regurgitation are the most common, and it can cause a number of complications. Those are mainly from inflammation from the stomach contents that are coming back up, the acid, those digestive enzymes. Esophagitis is the most common, and chronic inflammation can cause a problem called Barrett's esophagus, and it can also cause strictures, scarring down of the esophagus that makes it difficult to swallow. All right, let's try another set of questions. Why GERD is worse at night? Your symptoms are worsening at night because when you lay down, you lose the assistance of gravity that's helping to hold reflux contents into the stomach. Rather than that reflux having to travel up, it only has to travel sideways. So 2 tips. First, you may be tempted to take your PPI at night before bed when the symptoms are worse, but I don't want you to. I need you to take it before dinner because that's when acid is made. Second, gravity is your friend, so you may sleep better by raising your head up. Do that by using an additional pillow or place some blocks under the feet of your headboard. Why GERD causes chest pain? The inside of our body doesn't discriminate very well between the esophagus and its neighboring organs, so people can mistake the pain of esophageal reflux for the pain of a heart attack. Why GERD causes cough? When a large volume of reflux travels all the way back up your esophagus, that's regurgitation. And when that regurgitation erroneously falls down into the airway, it causes you to cough. Why GERD causes bad breath? If a large amount of that regurgitation that we just spoke of for the cough gets all the way up in your mouth, that's going to smell bad and taste bad. Let's move on to another question set. How GERD happens. Everyone has some amount of stomach contents that reflux back into their esophagus. This occurs because of transient lower esophageal sphincter relaxation. After a large meal, when the stomach distends, those relaxations become more frequent and longer, which permits more reflux back into the esophagus. Some people are more prone to have more relaxation and more irritation from the contents that reflux, and these people have gastroesophageal reflux disease. It's because they have such a large amount that's causing problems like inflammation of their esophagus or other symptoms like heartburn or the effects of regurgitation, the sense that they always have something stuck in their throat. All right, let's move on to another question. How does GERD cause shortness of breath? This is for the same reason that we discussed earlier, that patients can encounter a cough or bad breath. If there's a sufficient amount of reflux that gets all the way up to regurgitate, it may fall down into the airway. The deeper that regurgitation falls, the more severe the symptoms can be. It can irritate the airway, causing an asthmatic-like feeling, or it can even get deeper into the lungs, and there can be a concern that some patients get pulmonary fibrosis from long-standing GERD. Now, this is quite rare, it's a little bit debatable, but it is a point of concern for these patients. Let's conclude with one more question. How to get rid of GERD? If only it could be that easy. There's definitely several things you can do to make the symptoms more mild. The first thing is to have lifestyle changes, because when we eat a large meal, that makes the stomach distend and permits more reflux. So a lot of symptoms can be moderated simply by avoiding food triggers. These are commonly heavier, spicier foods, tomato sauces, but mint, chocolate, and fatty foods can also be triggers. Alcohol is also a culprit. So there's a lot of importance to emphasize on lifestyle changes. Medications are important to take if you have severe symptoms, and when symptoms are really bad and refractory, it's worth doing an endoscopy to look for other causes and potentially to consider an anti-reflux surgery. If you'd like more information on some of those medication and lifestyle changes, subscribe to the channel and check out other videos. There's a lot more here that we cover on GERD, its myths, and how to manage it. Thank you for watching. Be safe.